Have you ever been jolted awake in the middle of the night by excruciating leg pain? Those sudden, involuntary muscle contractions can feel like your muscle is being twisted into knots. For many seniors, these painful episodes aren't just occasional inconveniences. They're regular torments that can significantly impact quality of life. What's worse, you might be unknowingly making simple mistakes that trigger these painful episodes. Today, I'm going to reveal the 6 most common mistakes that cause leg cramps in seniors. And I promise, number 4 will completely surprise you. Many of my patients struggled with debilitating leg cramps for years until they discovered these hidden triggers. The good news? Once you identify which of these mistakes you're making, you can make simple changes that could bring relief. Within days, not months. Before we dive in, if you're serious about improving your leg health and preventing those painful nighttime cramps, hit that subscribe button and bell icon right now. I share new, science-backed solutions for senior health every week. And if you've ever experienced painful leg cramps, give this video a thumbs up. It helps more people like you find this potentially life-changing information. Now, let's get into the first mistake that might be causing your leg cramps. Chronic dehydration. Many seniors don't realize they're chronically dehydrated, setting the perfect stage for painful leg cramps. As we age, our thirst sensation naturally diminishes, making it easier to forget to drink enough water throughout the day. This reduced hydration leads to electrolyte imbalances, particularly sodium, potassium, and magnesium, which are essential for proper muscle function. When these minerals become imbalanced due to insufficient fluid intake, muscle cells can't contract and relax normally, resulting in those painful cramping episodes. The dehydration problem often worsens at night, which explains why many seniors experience leg cramps during sleep. Throughout the day, your body gradually loses fluids, and without proper replenishment, muscle cells become more irritable by bedtime. A simple way to check if you're dehydrated is to observe your urine color. It should be light yellow, not dark amber. Another indicator is dry mouth, particularly in the morning, which signals your body didn't have adequate hydration overnight. Reversing this pattern doesn't mean you need to drink gallons of water all at once. Instead, try spreading your fluid intake throughout the day with small, consistent amounts. Keep a water bottle within arm's reach and take sips every 30 minutes, even if you don't feel thirsty. For those who find plain water unappealing, try adding slices of cucumber, lemon, or berries to enhance the flavor naturally. Herbal teas, particularly those containing chamomile or mint, can also count toward your daily fluid intake while providing additional health benefits. The key to preventing dehydration-related leg cramps is consistency. Making water consumption a habit rather than an afterthought. Consider setting gentle reminders on your phone or linking drinking water to other regular activities, like taking medications or watching your favorite TV programs. However, proper hydration alone might not eliminate leg cramps if you're making another critical mistake: not getting enough of certain essential minerals in your diet. This nutritional gap could be silently contributing to your muscle pain, regardless of how much water you drink. Magnesium deficiency. Magnesium deficiency is perhaps the most overlooked cause of leg cramps in seniors, yet studies show up too. 80% of older adults don't get enough of this critical mineral. This essential nutrient acts as a natural muscle relaxant, helping regulate the nerve impulses that control muscle contractions. When magnesium levels fall too low, muscles become hyperexcitable, leading to those sudden, painful cramps that wake you up at night. Unfortunately, many common medications prescribed to seniors, including certain blood pressure medications, diuretics, and acid reflux treatments, can deplete magnesium levels even further. What makes this deficiency particularly troublesome is that standard blood tests often miss it. A normal blood magnesium level doesn't necessarily mean your muscles have enough, as only 1% of your body's magnesium is actually found in your bloodstream. The majority is stored in your bones and tissues, making deficiencies difficult to detect until symptoms like leg cramps, muscle twitches, or heart palpitations appear. Additionally, the modern diet is notably low in magnesium, with processed foods replacing the natural, magnesium-rich foods our bodies need. Adding magnesium-rich foods to your daily meals can make a remarkable difference in preventing leg cramps. Dark leafy greens like spinach and kale are excellent sources, as are nuts, especially almonds, seeds, particularly pumpkin seeds, and whole grains. One patient of mine, Barbara, had suffered from nightly leg cramps for years until she started eating a quarter cup of pumpkin seeds daily and including more spinach in her meals. Within just 2 weeks, her leg cramps had decreased by nearly 70%, allowing her to sleep through the night for the first time in years. For some seniors, however, dietary changes alone may not be sufficient, and a high-quality magnesium supplement might be beneficial. Magnesium citrate, glycinate, and malate are generally well-absorbed forms, while magnesium oxide tends to be less bioavailable. Always start with a lower dose and increase gradually to prevent digestive discomfort, and of course, consult with your healthcare provider before beginning any new supplement. While addressing magnesium is crucial, there's another everyday habit that might be triggering your leg cramps, one that's particularly common among active seniors trying to stay healthy. Improper exercise routines. While staying active is vital for senior health, improper exercise routines can actually trigger leg cramps rather than prevent them. Many seniors jump into exercise programs without proper warm-ups, causing their muscles to contract too suddenly without adequate blood flow. This abrupt transition from rest to activity places excessive stress on muscle fibers that may already be weakened with age. The resulting microtears and inflammation often manifest as painful cramping, particularly at night when your body is attempting to repair this damage during sleep. Another common exercise mistake is focusing exclusively on high-impact activities without balancing them with flexibility training. Walking, jogging, and even dancing are excellent for cardiovascular health, but without complementary stretching, muscles can become progressively tighter and more prone to cramping. Tight calf muscles are especially susceptible to nighttime cramps, as this tension can be exacerbated when your feet are pointed downward during sleep. Regular hamstring, calf, and foot stretches before bed can significantly reduce this risk, giving your muscles the flexibility they need to relax properly overnight. Dehydration during exercise compounds these issues, particularly for seniors, who may not drink enough water before, during, and after physical activity. When you exercise, your body loses critical electrolytes through sweat, including potassium, sodium, and magnesium, all of which are essential for proper muscle function. Even mild dehydration during or after exercise can dramatically increase your risk of experiencing painful leg cramps later that night. To prevent this, try drinking about 8 ounces of water 30 minutes before exercise, small sips during activity, and at least 16 ounces afterward to replenish what's been lost. Creating a balanced exercise routine that includes proper warm-ups, strength training, cardiovascular activity, and dedicated flexibility work will provide the most benefit with the least risk of cramping. Consider activities like water aerobics or swimming, which provide resistance for strength building while minimizing impact on joints. Tai Chi and gentle yoga are also excellent options for seniors as they combine strength, balance, and flexibility training in low-impact formats. However, even with the perfect exercise routine, there's another factor that might be sabotaging your leg health, one that could be sitting in your medicine cabinet right now. Medication. Side effects. Many seniors don't realize that common medications can be a hidden trigger for painful leg cramps. Certain prescription drugs, particularly those for high blood pressure, high cholesterol, and asthma, can interfere with muscle function or deplete essential minerals that prevent cramping. diuretics, water pills, often prescribed for heart conditions or high blood pressure, cause increased urination that flushes out potassium and magnesium along with excess fluid. This mineral depletion can leave muscles vulnerable to painful spasms, especially during the night when circulation naturally slows. Statins, which millions of seniors take to manage cholesterol levels, are another common culprit behind leg cramps. These medications can cause muscle-related side effects ranging from mild discomfort to severe pain. The exact mechanism isn't fully understood, but research suggests statins may affect the way muscle cells process energy or reduce levels of coenzyme Q10, a compound essential for muscle function. What's particularly confusing is that these cramps may start weeks or even months after beginning the medication, making the connection difficult to identify without careful tracking. Beta blockers, commonly prescribed for heart conditions and high blood pressure, can also contribute to leg cramps by affecting blood flow to the extremities and altering how muscles respond to nerve signals. Similarly, some antidepressants, particularly those in the SSRI class, have been linked to increased muscle cramping in some patients. These medication-induced cramps often follow patterns that differ from those caused by dehydration or electrolyte imbalances. They may occur at specific times of day or affect different muscle groups in distinctive ways. If you suspect your medications might be contributing to leg cramps, it's crucial to maintain a symptom journal tracking when cramps occur and their severity. Armed with this information, consult your healthcare provider about possible alternatives or adjusted dosing schedules. Never stop taking prescription medications without medical supervision, as this can lead to serious health consequences. Your doctor might suggest taking certain medications at different times of day, adding a supplement to counteract specific side effects, or switching to an alternative drug with a similar benefit but different side effect profile. While medication side effects are important to consider, there's another daily factor that might be triggering your leg cramps, one that involves what you eat every day. Poor dietary choices. The typical modern diet is surprisingly problematic for muscle health, especially in seniors prone to leg cramps. Highly processed foods, excessive sodium, and refined sugars create the perfect storm for muscle dysfunction. These dietary choices not only fail to provide the essential nutrients muscles need but actively deplete existing mineral stores. Processed foods typically contain high levels of phosphates, which can bind to calcium and magnesium in your digestive system, preventing proper absorption of these crucial minerals. When combined with naturally decreasing absorption rates as we age, these dietary factors create a significant nutritional deficit. Sugar consumption presents another challenge for muscle health as it increases inflammation throughout the body and can disrupt proper calcium regulation in muscle cells. The resulting mineral imbalances make muscles more irritable and prone to involuntary contractions. Even seemingly healthy choices can sometimes contribute to leg cramps. Certain vegetables like spinach, while excellent sources of magnesium, are also high in oxalates that can bind to minerals and reduce their availability to muscle tissues. This doesn't mean avoiding these nutritious foods, but rather balancing them with low oxalate alternatives like cucumber, zucchini, and lettuce. Caffeine and alcohol consumption frequently contribute to leg cramps by promoting dehydration and interfering with normal sleep patterns. Coffee, tea, and alcoholic beverages act as diuretics, increasing fluid loss and potentially depleting electrolytes essential for proper muscle function. Additionally, alcohol can interfere with the body's ability to replenish glycogen, stored energy, in muscles, leaving them more vulnerable to fatigue and cramping. Many seniors don't realize that their evening glass of wine or after-dinner coffee might be directly contributing to those painful midnight leg cramps. Adopting an anti-cramping diet doesn't require extreme measures. Simple adjustments can make a significant difference. Focus on consuming potassium-rich foods like bananas, sweet potatoes, and avocados, which help regulate muscle contractions. Include sources of natural magnesium like nuts, seeds, and beans in daily meals. Ensure adequate protein intake, as amino acids are essential for muscle repair and maintenance. Consider reducing sodium intake while increasing potassium, as the ratio between these minerals affects fluid balance and muscle function. While dietary changes are powerful, there's one more factor that might be causing your leg cramps. 1. That affects nearly every senior but is rarely discussed. Poor circulation and inactivity. Poor circulation is a silent contributor to leg cramps that affects countless seniors, yet many don't make the connection between their sedentary lifestyle and nighttime pain. When you remain in the same position for extended periods, whether sitting in a favorite chair or lying in bed, blood flow to your leg muscles becomes compromised. This reduced circulation means less oxygen and fewer nutrients reach muscle tissues, creating the perfect conditions for painful cramping. The problem often worsens at night when horizontal positioning further changes circulatory patterns, explaining why many seniors experience their worst cramps during sleep. The natural age-related changes in blood vessels compound this problem. As we age, blood vessels become less elastic, and peripheral circulation naturally decreases, particularly in the extremities. This reduced blood flow means waste products from muscle metabolism, including lactic acid, can build up more, easily irritating nerve endings and triggering cramps. For seniors with conditions like peripheral artery disease, diabetes, or heart issues, these circulatory challenges can be even more pronounced, making leg cramps more frequent and severe. Breaking the inactivity cycle doesn't require strenuous exercise. Even small movement changes throughout the day can significantly improve circulation. Simply standing up and walking around for 3 to 5 minutes every hour can maintain better blood flow to leg muscles. Gentle ankle circles, calf stretches, and knee lifts while seated are simple exercises that promote circulation without requiring significant physical exertion. For those with limited mobility, seated exercises or gentle foot and ankle movements can still provide substantial circulatory benefits. Compression socks represent another effective solution for improving leg circulation, particularly for seniors who experience swelling or heaviness in their legs. These specialized garments apply gentle pressure that helps blood return more efficiently from the legs to the heart, preventing fluid accumulation and improving overall circulation. For best results, put compression socks on first thing in the morning before swelling develops, and choose the appropriate compression level based on your specific needs and any underlying health conditions. While addressing circulation is vital, it's equally important to understand how these 6 factors interact with each other to trigger those painful nighttime leg cramps. Now that you understand these 6 common mistakes that cause leg cramps, it's time to take action and reclaim your comfort, especially during those precious nighttime hours. Think about which of these factors might be affecting you personally. Is it dehydration, magnesium deficiency, improper exercise, medication side effects, poor dietary choices, or circulation problems? Most likely, it's a combination of several factors working together to trigger those painful episodes. The good news is that addressing even 1 or 2 of these areas can bring significant relief within weeks or even days. Remember that preventing leg cramps isn't just about comfort. It's about maintaining your independence and quality of life. When painful cramps interfere with sleep and mobility, they impact everything from your energy levels to your ability to stay active and engaged in life. By making these simple changes to your daily routine, you're not just preventing pain. You're investing in your overall well-being and ability to enjoy your golden years to the fullest. Have you been making any of these 6 common mistakes? Which one surprised you the most? Share your experiences with leg cramps in the comments below. Your insight might help another viewer find relief. If this information was valuable to you, please give this video a thumbs up and subscribe to our channel for more practical health tips designed specifically for seniors. Don't forget to hit that notification bell so you never miss our new videos on improving your health naturally. Remember, small changes today can lead to pain-free nights tomorrow.